Okay, I think we're going to go ahead and get started. Thank you all for joining us. My name is Dr. Bertha Sewa Ayi, the president of Ghana Physicians and Surgeons Foundation of North America. And today I'm moderating our webinar. Go ahead and get started. Thank you all for joining us. I'm moderating our webinar series for today. And our speaker for today is Dr. Nancy Abu-Bonsra. So Ghana Physicians and Surgeons Foundation is a not-for-profit organization formed 20 years ago. We're going to be 20 next year, and we're very excited about it. Our focus is to partner with physicians in Ghana to improve the healthcare infrastructure. And we also undertake various activities to promote networking, to enhance learning, and generally to improve medical education. Our speaker for today, Dr. Nancy Abu-Bonsra, is originally from Ghana. She migrated to the US at the age of 15 years and completed her undergraduate education in biochemistry and chemistry at Mount St. Mary's University in Maryland in 2012. And then she proceeded to medical school at the prestigious Johns Hopkins University School of Medicine, completing in 2017. And that year she made history because social media was abuzz with this young lady who was the first African-American woman to make it into neurosurgery residency at Hopkins, with very high flying colors as well. Well, she's 6 years into her neurosurgery residency, and some of the things she's been working on, including looking at Ghanaian neurosurgery literature. And so she'll be sharing that with us. In addition to pursuing neurosurgery, she also has an interest in health equity and global neurosurgery. And she recently completed her MPH, Masters in Public Health, at the Johns Hopkins Bloomberg School of Public Health, and has become a recipient of the NREF-directed Residency Scholarship, the Johns Hopkins Sherman Traveling Award, and the 2022-2023 American Association of, what's AASF?
It's the Association of Academic Surgeons.
Okay, Association of Academic Surgeons Global Surgery Research Fellowship Award. And so, Nancy, congratulations on all these multiple academic awards. I know you're super, super smart. So Nancy's going to be our speaker tonight, and she's talking about the topic biometric analysis of Ghanaian neurosurgical literature. So please welcome Nancy. And Nancy is the epitome of motherhood and professionalism. So she has her toddler with her, and we just love it. So.
Thank you for the very kind introduction. I'm just working on sharing my screen real quick. Here, go give it to Daddy, please. Okay. Okay, great. Good, thank you. Thank you guys for joining us for this talk. Hopefully it wouldn't be very long. As Dr. Ayi mentioned, my name is Nancy. I'm one of their neurosurgery residents here at Hopkins. I am currently in my 6th year, hopefully working and graduating in 2024. We have some elective time during neurosurgery residency, so I chose to spend my time working on some global neurosurgery projects because I've had an interest in doing that for some time. And I figured this would be the best opportunity to pursue some of those interests during residency with their protected schedule. I also like that's why you mentioned, did an MPH because of my interest in global neurosurgery as well as in public health in general. So one of the projects that I spearheaded this year was looking at some of their literature in Ghana that's been published around the neurosurgery, and to kind of discuss where, what the focus has been and how we can potentially address some of the deficits that might be in neurosurgery for the country. So this paper was recently published, and I will take us through it very quickly. This was an effort between myself, some med students in Africa, and postdoc fellows here in the US, as well as some physicians and neurosurgeons in Ghana. And I'm greatly indebted to them for giving me the opportunity to work with them. The outline for this is very simple. We're gonna go briefly over the background. We will talk about some of the objectives for this particular study, the methods that were used, results, and the conclusions. So just briefly, in terms of neurosurgery, sorry about that. So in terms of the background, as part of my time looking at neurosurgery in Ghana, I also completed a project that looked at where neurosurgery is completed in the country and also what they have available to them. So in terms of literature on neurosurgery in Ghana and similar countries is fairly limited. There's been a couple of studies recently looking at literature from places like Ethiopia or Somalia, comparing them to the literature that's available in the global sphere. And what they've generally seen is that the literature has been fairly limited compared to places like, let's say, the United States or Japan or some of the other Asian countries. The reason to do bibliometric studies is fairly straightforward, is to look at a bird's eye view of what has been done with the literature and what themes you can kind of map out based on that bird's eye view. It's a little bit different and less of a deeper dive than doing, systematic literature reviews and such. And there are reasons to do it depending on how broad the topic is. So for this particular study, doing a scoping review kind of fit that very well. So in Ghana, currently, there are 4 centers that, 4 regions in Ghana that provide neurosurgical care. There's the northern region where there's 1 center and 1 neurosurgeon, Dr. Abbas Adam, which kind of serves that area as well as some of the other areas that are close to it, like the upper east and west regions. There's 1 center in the Ashanti region, which is at the Komfo Teaching Hospital, where there are 4 neurosurgeons, where 1 of them is part-time, as well as a training program. Most of the centers are in the Greater Accra region, of course, where most of the neurosurgeons are. And there is 1 training program at the Kolebu Teaching Hospital. And then there's 1 more center with 1 neurosurgeon in the central region. So obviously, compared to places like the United States, the number of neurosurgeons in the country is fairly limited. Additionally, if you were to look at the number of neurosurgeons in totality there, it's even a little bit less than all the neurosurgeons that we have at Hopkins, for instance. So obviously, the number of people that are going to be looking at neurosurgical issues are going to be fairly limited, which would reflect on the output that they would produce ultimately. In terms of the objective of this particular study, we wanted to assess the trends and the scholarly activities and the themes that emerge when people are discussing neurosurgery in Ghana in the literature, and then to determine things that could potentially be done to improve the neurosurgical research landscape. the reason why some of these things are important, which we'll talk about later, is particularly in the US and in academic centers, everyone knows that research is currency in terms of your ability to talk meaningfully about certain conditions and certain treatments, as well as to even secure funding for certain research projects. If you don't have data, or if you're not able to assess some of these things, you're not able to do those things. Additionally, and even more important, it's a little bit harder to improve outcomes for patients because you don't exactly know what works and does not work for your particular practice setting. So it's helpful to be able to undertake research, and it's important to know what's available in the first place. The methods that we use for this particular study is pretty standard for scoping reviews and bibliometric analysis, as well as, systematic reviews. We use the PRISMA guidelines. We decided to focus on 4 databases, which we hypothesize would have most of their literature that's been written, regardless of where it's coming from. So PubMed, which is the most common vehicle that we use here. There's Embase, which is the PubMed equivalent for the European scientists. Our Global Index Medicus and Web of Science were included as well. They have a more expanded reach, and they tend to include more countries in our low and middle income countries like Ghana. The articles that we abstracted for initially was done from inception of those databases until December 21st, 2021, when the searches were run. And we imported all that data into a software system called Covidence, which allows you to look through literature very quickly to determine articles that you want to use for particular studies and to begin to collect certain data on those articles. So for the selection process for the articles, there was an initial abstract and title screen. We had a couple of reviewers. Each article had to be viewed by at least 2 individuals, and they could indicate whether the articles fit our inclusion and exclusion criteria, or our inclusion criteria, they needed to be excluded for any particular reason. And where there were conflicts between the 2 reviewers or screeners, there would be a third person who would decide one way or the other if that article had to be included. For initial abstract and title screens for a lot of literature reviews, these tend to be more expansive so that you get as many articles as possible. And then you move on to the next stage, which is the full text screen. So instead of just reading the article and the title and making a decision for articles that we think are relevant from the initial screen, you get the full text articles so that you can look through the article body itself and make a more informed decision as to whether or not the article should be included. And this tends to be a little bit more restrictive in terms of following your inclusion criteria very strictly, so that you make sure that you're including articles that are very necessary. So our inclusion criteria was that the articles had to be in English. They had to be surrounding neurosurgical topics in some way, shape, or form. They had to be from Ghana, discussing Ghanaian patients in particular, or the Ghanaian neurosurgical system. And then the article ultimately narrowed it down to go from 1965 to 2021, primarily because in the literature and in talking to people, neurosurgery became more of a thing in the late 1960s. So ideally, the intent would be that keeping that in mind, you're more likely to find a little bit more of an organized perspective of neurosurgery when you started from that time period. Now, just as a caveat, which is not included here, based on the articles that we excluded for that criteria, there really weren't any neurosurgical articles, so we didn't lose any articles from limiting that date. The exclusion criteria is obviously the mirror image of the inclusion criteria. So obviously have to be in the date range, have to be English, if it's non-English related, non-neurosurgical. If it did not include Ghana, even in multi-center studies, then those were excluded. We extracted data from using a standardized form through Covidence, and the variables are indicated on their slides. So we looked at the year the articles were written, the title, where they were sent, authors that were involved, their specialties and affiliations, and so on and so forth. And then even with the data extraction, it required at least 2 people to extract the data. And if there were any incongruence between what was collected, a third reviewer would look through and make sure that everything was consistent. So in terms of the results or the outcomes of this particular study, first off is a first figure. So we looked through the 4 databases that I mentioned. I came up with about 927 articles, of which 228 were removed because they were duplicates. Ultimately, we screened almost 700 articles and excluded close to 600 articles based on the title and abstract screen because they were just not relevant to this particular study question. And then the articles that were left, a little over 100, where, full text of those articles were obtained. And then from that, we curled it out to 66 articles that we ultimately included that fit our inclusion criteria. So in terms of the articles, I noticed a little bit of a busy table, but what you notice is that a lot of the articles were retrospective or prospective cohort studies, case reports or epidemiological studies or cross-sectional studies. What you don't see here are any basic science research or translational research or any randomized controlled trials, which tend to hold a little bit of a higher currency for some of their diseases that we study in neurosurgery. I thought it was very interesting that most of the articles were actually sent to African journals, whether it was the West African Journal of Medicine or the Ghana Medical Journal, versus articles that were sent abroad. And it kind of speaks to the fact that there is a research infrastructure in Ghana. There are journals, which anyone can tell you about, that articles are sent to, which the relevant parties can read, and obviously will be helpful for them and their practice in the country. The topics that were studied for the most part were about spine and trauma, and some cranial tumor infection and PEDS and so on. Spinal pathology represents like a significant portion of their pathology that we treat as neurosurgeons, so it's not very surprising. And obviously trauma is very ubiquitous, especially in a place like Ghana where it's a little bit difficult for road safety rules to be adhered to. What you'd also notice is that the other specialties, or subspecialties within neurosurgery that are not exactly covered, including functional and vascular, represented a minority of the articles. Again, not very surprising based on my experience there and also the experience of a lot of other neurosurgeons, because we don't necessarily have the infrastructure to support that kind of specialized care that involves functional neurosurgery, which would include, for instance, DBS placements for patients with Parkinson's. And similar for vascular surgery, again, very limited, which requires a lot of very specific equipment and a specific skill set, which a lot of the neurosurgeons in Ghana do not have access to at this time. In terms of the trends and publication, what was noticed is that over the years, across the decades, at least since the 1960s, there's been a general increase in the number of articles that are published. Obviously, it's not a lot. And if you look at the number of articles that are published, it's certainly across the whole country, across all the years that we found with this particular literature review, it's certainly much less than, let's say, a robust academic center in the United States. There was a decrease in 2020. I think it's not surprising because of their whole COVID situation. But at least over time, there's been some exponential increases in the number of articles or studies that were published in their academic literature. This one kind of looks at some of the words or keywords that were associated with some of the articles, and it just presents another view of the topics that were addressed. In terms of authorship trends, there were an average of 4.7 authors per article, and they came from an average of 2.4 institutions per article. Again, not written here, but a lot of the authors were actually Ghanaian authors, and it was very few articles that did not have an affiliation to a Ghanaian institution. It was only about 3. All the rest had some affiliation with the Ghanaian institutions, which suggests that there was, robust interest among Ghanaians in terms of, looking at some of these studies. There were a decent number of collaborators from different countries as well, which included the United States, China, Spain, Ethiopia, and the United Kingdom. But again, most of their articles were done by Ghanaians themselves as well, which I think is very promising. In terms of funding, a minority of their articles had any sort of funding, and most of these were either institutional funds or national organizations or industry funds, or a few of them came from a benefactor who donated to one hospital in Tema to do a lot of our retrospective studies over time. In terms of the limitations that people or the authors mentioned in their article, these include having smaller sample sizes, there being delays in terms of when patients presented for treatment, and even the time from presentation to treatment as well. They mentioned having inadequate diagnostic tools or specialty care for certain things. And that includes, having, let's say, an MRI to make certain diagnosis or a CT scan. And neurosurgery does not exist in a vacuum. After you do your cases or you operate on patients, they do benefit from other specialty services, like, let's say, a specialized ICU unit or physiotherapy and such, which is not exactly available or possible in a place like Ghana for most of the patients that the neurosurgeons encounter. Some of the other challenges that were mentioned include loss of follow-up, which makes it a little bit hard to have a longitudinal database because you can't reach the patient, or you can't study the patient for a long period of time, which is a little bit different in a place like the United States where there's a little bit more consistent follow-up. Some of it also tends to be due to the fact that there's just not anyone who is specifically dedicated to doing the research. So obviously there are neurosurgeons who are small to begin with, are not able to actively follow patients who may not want to be followed or cannot be found to be followed because obviously they have other clinical responsibilities that they need to take care of. In terms of when there are multi-center studies, there are some studies that involve like scoliosis and deformity spine surgery. For example, their Focus Hospital has a very sought after specialty deformity center in Ghana who does a lot of spine surgery for kids. But when there are multi-center studies, not just for Ghana, but for other centers as well, there's a little bit of heterogeneity in the patient care that's received, because one center might have the ability to provide certain imaging or infrastructure for their patients, and another center may not, which would reflect in the patient outcomes just because they don't have access to those things. There was varied knowledge of neurosurgical diseases among study population, so they may not necessarily understand what condition they have, why they may need certain treatments, why they need to seek care, or who they need to seek the care from. And again, limited access to support structures as mentioned before. For this particular study, obviously we're limited in our ability to fully assess everything based on the number of articles that came from a search that we did. And because it's a scope and review, obviously you're not going to be able to do a deep dive of all the articles, and pick out certain nuances because you're trying to get a bird's eye view of everything. We could have included more research databases, but the four that we included does capture a lot of their academic research output out there. But for example, we could have tried to find more articles on Google Scholar that may not have shown up in our initial search. We obviously did not include articles that were written in a different language. And I think while that's a limitation, because English is the national language of the country, most articles would be written in English in the first place versus another language like French, for instance. But more importantly, in terms of their overall broad conclusions of this particular study, we did find a limited number of articles that were written about neurosurgery in Ghana. They did mention that there were significant limitations that made it difficult to pursue research, including lack of funding to pursue the research. Now, there would be a lot of discussion about what to do to ensure that the research landscape is a little bit more robust. And some of these things are not unique to Ghana by any means, or even unique to academic centers or a place like the United States, depending on where you are. So obviously, increasing research funding is very helpful. If you have a group where they have to survive on clinical volume or doing as many cases as possible, seeing as many patients as possible, obviously their time is not going to be spent doing research that they're not going to be compensated for, or that they're not going to have dedicated people to pursue. So that makes it a little bit difficult to embark on very worthy research causes that they might have or ideas that they might have. It would be helpful, obviously, to have longitudinal institutional databases, because that way you are able to do prospective and retrospective studies on the outcomes of patients, and you're able to identify things that work well for your patient population or does not work well for your patient population, so you can make changes with respect to that. Obviously, training consultants and residents or med students in research methodology is very helpful. Like in the United States, we do have some of that built into our curriculum, and they do have some of that built into the curriculum in Ghana as well, but maybe making it a little bit more robust than what it is right now, and providing the resources necessary for those who are interested in research. Like, for example, statisticians who are able to help, help do complex analysis on data sets and such will be helpful. And as mentioned before, it's better if you're able to increase the incentives for neurosurgeons who may want to do research. So that would come in the form of funding, it will come in the form of providing them manpower, it will come in the form of decreasing how much they need to spend in clinical time so that they are able to still get adequate compensation, even if they're not cranking out a lot of cases or seeing a lot of patients. Strengthening international research collaborations are also helpful for this particular initiative as well, because you can learn from other centers, you can pull data together, you can look at what's different across countries or across specific regions. And it's important because it allows you to tailor recommendations of what to do for your particular country. And then obviously increasing the engagement of trainees and research projects would help for a lot of academic centers, and not insignificant amount of research is done by trainees, and with our attendants and consultants supervising that research and kind of making sure that everything goes well. So obviously, if you increase the engagement of trainees, they're more able to get things done and kind of push the research agenda forward when the attendant or consultant might not have the time to do so. So that's the end of the presentation. These are some of the references that are used, and too many references. And I will stop here and take questions. So Dr. Ai, are you still there?
Yes.
Okay. So I don't know how it works with the webinar. I guess questions, are people able to like verbally ask questions, or it has to be put in the Q&A?
So they can put it in the Q&A, or put it in the chat room. I think there are 2 questions already, so thank you very much for wonderful summary of your research. So thank you all for joining us, by the way. My name is Marisha Soa, and I'm a second-year medical student interested in neurosurgery and global neurosurgery. I want to ask how medical students can get involved in these global health initiatives and research opportunities.
So, the way it works is it depends on where you are, and what academic institution that you are in case there are neurosurgeons that are interested in something similar that you can work with. But one of the other things is that there are a lot of other institutions that do similar work, and they're always happy to host students who want to participate in research. So you can always send emails to those institutions or those attendants that are interested in doing some of that global neurosurgery research. So for example, there's the DGNN at Duke. They do a lot of neurosurgery and neurology research in global neurosurgery that you can kind of look at and also join. They have meetings every Friday, and they have a ton of projects if you're interested in pursuing them. There's also programs in Boston where they do have like a lot of subspecialty surgery that are interested in global health, like that's called their PGSSC. But both of them do provide a good avenue for you to be able to reach out to these people to do it. And of course, you can reach out to me if you and if there's any research that I'm doing, I can loop you in. But it can be a little difficult. Thankfully, global neurosurgery is getting a little bit more of a rep. So there's a lot more people that are doing it. So it's a little bit easier to reach out to people. But some of the places I can put it in the chat, there's the DGNN, there is the PGSSC, and then there's the global neurosurgery program at the PGSSC. And then there's also the Vanderbilt global neurosurgery division, which also does a lot of projects as well. But it can be a little bit difficult depending on where you are and what's available. But I would start with your institution to see if there's anyone who's interested in doing something similar. And then if not, then you could reach out to other people and go from there who are in a little bit more established programs.
Okay, so thank you very much for your response. So I would suggest that Marisa Soa can sidebar you in the chat room and get your information so that you can assist them further. And then Angela Kumson has a question. How do you think your findings in this study compare to other fields of medicine?
like specifically in Ghana or like worldwide? I mean, specifically in Ghana, I didn't, study it, but one would assume that it would be fairly similar in terms of, what literature is out there. But you can imagine that for things like, let's say, OBGYN or infectious diseases, it might actually be, some of the literature would be better because there's a more interest, more people are involved in doing that. And there tend to be more international collaborations surrounding those than for, subspecialty stuff like neurosurgery or transplant surgery, for instance, or even ENT. So I think that in terms of in Ghana specifically, there are programs or specialties that are a little bit better in terms of their academic output than these subspecialty programs, for instance. We didn't study it directly in this particular study, but I would imagine that depending on what specialty it is, it might be better or worse. At the end of the day, it's probably still much less than in the US, but might be better for other specialties.
All right, sounds good. Thank you. Angela has a follow-up question. What are your suggestions on the immediate next steps to improve research participation in the Ghanaian healthcare system?
So I can mention what I've done or what I've looked into, and that's mostly been involving a lot of their residents and the attendants and their research or papers that I'm interested in, or the other projects that I currently want to pursue, and trying to get them on board, involving them in the initiation process all the way to the end to the publishing of the articles. I think that's probably like the most easiest way to be able to kind of get that process going. The other ways to do so obviously would be to embark on research presentations or a way to show people how to do research, how to publish your data, how to write about what you're doing in the first place. One of the things that they do in Ghana, which is very helpful, at least for the neurosurgery department, is that they do, as part of the residency, require each resident to do a thesis. So that means that each resident can pursue a research project and write about it. So that's obviously an easy way to get people to participate in research. I don't think that they do publish most of their outcomes, unfortunately, but obviously one of the things that someone could do would be to help support those thesis projects and get them to submit their articles to journals so that they can get it recognized outside of the Ghanaian neurosurgery system.
Okay, thank you.
Those are some of the things that I can think about.
All right. Thank you for that answer. And Dr. Victor Owusu is asking, what is the process of neurosurgery training in Ghana?
So briefly from what I know and I've gathered is that, so once you finish medical school in Ghana, you have to go through the housemanship and then the medical officer stuff. So everyone has to do that. And then once you make it through that, then you can enter into a residency, depending on what you want to do. So for neurosurgery, once you're done with that, then you can, enter your neurosurgery training. So you have to do 3 years of general surgery and then do your fellowship exam. And then after that, you have to do 4 years of clinical neurosurgery. And then you have to do another exam to, I think, become what is the equivalent of us, like a board certified neurosurgeon, once you go through that. So there are 2 training centers in Ghana, like I mentioned before. There's the one at Kolebu, and then there's the one at Komfo-Anokye. There's a partial training program at 37, but there are currently not any residents that are there. And what people do is, they do their general surgery stuff, and then they come to either Kolebu or Komfo-Anokye to do their neurosurgery stuff. If you're at Confinachi, you do have to spend some time at Kolebu for you to be able to get the full accreditation. And you can, the neurosurgeon can rotate through 37, and some of them do spend some time at Focus Hospital to get some more spine training as well. But that's basically the summary of how neurosurgery is done in Ghana.
Okay, excellent. Thank you for that answer. Dr. Victor Usu, did you have other questions? Did she answer your question very well? And if somebody wants to speak, I can allow them to ask the question directly instead of typing it in the chat room. Okay. So are there any other questions? Okay. Well, in the absence of any other questions, I want to thank Dr. Abu Bonsra. Clearly, you had to split your time between your parenting responsibilities and doing this. So we're very, very grateful. And we wish you all the best in your career as you complete your training. And I'd like to remind all of you that GPSF has a gala coming on tomorrow in Chicago. So if you haven't bought your tickets yet, please try and get your tickets, and let's see you in Chicago for our gala. And besides that, you can still donate if you're not attending the gala. Please go to our website and make a donation. We're looking to support our residents who come to Yale University in the Rights Program. We're also looking to support our Takwa missions project. There's a hospital in Takwa that we go and do some medical missions. And also we're looking to support our medical students. And also Ashanti Regional Hospital approached us about just a simple 3-bed oncology pediatric unit they're trying to put together. So we're trying to raise funds to support them. So please support a worthy cause. Angela said, thank you so much. It's a very helpful project. Thank you for doing this. So we still have a few minutes. I'll leave room for any other questions, and then we'll call it an evening.
Thank you for inviting me, and sorry for the distractions. But
no, it's actually not a
distraction.
distraction. You're being real. I think we want people to know that we're not just doctors, we're mothers, we're wives, we have a life besides seeing people who are sick. So it's actually kind of pleasant to see a baby.
Yeah, she's he unfortunately would not let you put him down. So
right, that's okay.
So
that's
here
okay.
we are.
Okay.
Yeah.
All right. Oh, so I have one more. I will tell Bonsoir grandpa to help his baby.
Yeah, no, my family has been helping us a lot. So
right.
We're very grateful. Very grateful.
Great. Yeah. All right. Well, thank you very much. Have a wonderful evening, everybody. And please go to GhanaPhysicians.org and make a donation towards all our fundraising projects. Thank you.